Go ahead.
Welcome this week to Western Medicine, the Humanity Behind the Vanity. We're on Talk 1260 KTRC. I'm Dr. Daniel Ronel, a plastic surgeon, and I'm here with my wife, Betsy. We're going to talk about a lot of things today.
And we've got a great show. But first we want to say we'll send our condolences to those 4 families who lost their children this week in the drunk driving accident. It's almost hard for me not to cry while I'm saying this, but it's just devastating to our community and to the world that 4 young lights have been extinguished way too early. And I know this sounds vengeful, but I do hope that the drunk driver goes to prison like he should, and they'll take care of him there. I also hope the state can hurry up and fix all the drunk driving laws that need to be fixed, because they are just so broken. So again, everybody who knew those children and their families, we send you our blessings, and we are so very sorry.
Okay, welcome back. What are we going to talk about this week, Liz?
So, you know, I thought we're in the new beauty issue this month, and I thought we'd talk about some of the articles that all women, sometimes men, read about, you know, these anti-cellulite creams, looking younger without surgery, and all the rest of it. So I wanted to sort of spring some of these off you and see what your thoughts are as a doctor.
Sure.
And this isn't to disparage the items, this is just to say whether they help, don't help, or you know, just extend the life of your surgery.
Okay.
So here's one. It says, I want to look years younger without surgery. And what are they trying to do? They're trying to sell you a non-surgical liquid facelift of creams, various creams. I'm not going to go over the creams, but this is about creams and stuff.
Okay, what Betsy's talking about is a magazine called New Beauty. You can find it on all the newsstands, I think.
They sell it in Borders at Barnes & Noble, I think, and I think at Flying Star.
It's got Heidi Klum on it.
Yeah, Heidi Klum in black on the
Anyway,
cover.
it's a magazine that's a...
And it's the makeover issue. Okay.
It's a very interesting magazine about what you can do to improve your looks aesthetically. What Betsy's talking about is there are a lot of products out there that are designed for people to replace the facelift or to rejuvenate the skin, and they do have a role in the world of looking good. Of course, they're not as definitive, as long-lasting, right, as a facelift, or even as the liquid lift with fillers, for example.
Right.
There's just no way they can last as long or look as good. However, they can be very efficacious on the surface. They can make your skin look great.
Effective.
Okay. They can get rid of fine wrinkles. And
can they? So, say a woman has had her first facelift.
Right.
Would you suggest using these types of regimens?
Absolutely. As part of my facelifts, we give our patients advice on how to take care of their skin. I have a medical esthetician involved. You got to protect your investment.
I'm just talking. Say a woman goes to another surgeon. It's not you.
Okay.
Shame on them. I'm kidding. You know, say they go to another surgeon. It's not you, and their surgeon doesn't have this whole team for aftercare and all that. And they go to the drugstore. They go, you know, and they say, "Oh, I want to buy this. I saw this on TV. It looks great. It's going to fight my wrinkles." Should they buy it?
Some of them will.
What are some of the key ingredients in these sort of facelift without surgery creams?
The way these things all work is they moisturize, and this is what Marion has been
saying.
That's what
Marion
says, right? I mean, they have a lot of fancy ingredients. Some of them do. Some of them even have Botox in them. I'm not quite sure how that works, but snake venom is another hot thing. Now actually paralyzes some muscles.
What about those creams with ice? Or Retin-A.
Yeah, Retin-A, I love Retin-A. All those different forms of the retinols exfoliate the top layer of the skin, they rejuvenate the skin, but the myth is that it's going to take 5 years off your face, it's off your age. It's not going to. Retin-A is something that you need to use consistently. It causes some reactions in some people, but you know, but my point is that the new skincare products are starting to include medical formulations such as Retin-A. That doesn't have to be the strong dose, but it's going to do some work.
Here's something, considering we live out in the high desert. What about sun?
Absolutely. Right. The sun can adversely affect skin that has Retin-A in it, so any good moisturizer or cream worth its salt is going to have a sun protection in it.
Well, it may not. You just then, if you use a Retin-A cream, then you add sunscreen on top of it.
You can do Marion's 7 layers.
Right, whatever. We'll find out about the 7 layers in a future show.
Right. So my point is these new products that are out there, most of them work great. They are not going to replace a surgical procedure or even an injectable procedure, but they are excellent for maintaining your looks. There's also products out there like home laser devices that I keep seeing pop up.
Yeah, what are those? What is the efficacy of those?
They're effective at a superficial layer. They don't last very long. Very good. All right,
thank you so much. I learn a new thing every day. That's my word of the day. Efficacy.
They're fine. They're fine, but
do
listen,
they really work, or
they're
just
not
more of
going
a feel-good thing?
They feel it's like going out and getting a tan. You feel great, and your skin might
don't
look.
they hurt? Laser in your
The ones that they sell for home use aren't
not
really
powerful.
painful. They're not that powerful, and that's why they don't work very well. But
they do have, I mean,
the
we don't
problem
want to
is
discount them. They do have some
yes, they do.
benefits, I'm sure. It
The
just takes a
problem
lot
is you
longer
can
to
end
get
up
them.
spending a lot of money buying very expensive
This
things,
home stuff.
and they're just not going to replace the definitive treatment with an expert, a laser expert, and a machine that, you
So
know.
they won't replace the result, the speed
Correct.
at which you get the result, and that's it.
Yeah, okay, no, you're right. And there's
And the
another.
cost in the end perhaps might be the same.
Right, right. And, you know, these laser home devices, they don't really go into the different colors of hairs.
Right, which Marion
You know,
said was critical.
right, a redheaded person is going to have a very hard time having laser hair removal.
Or a true blonde
people,
person.
right,
Yeah.
people who have
Or dark skin and dark hair.
right,
Yeah.
people who have dark skin are very sensitive to lasers, they can scar, and so for that reason, there's no way they could be on the market if they were really that powerful.
Right, okay.
Right,
So
and that's why they just don't work very well.
All right, okay, here's a big thing that I used to use in college.
Hmm.
What about this? Here's an article entitled, "I Want a Smoother, Tighter Butt." These are skin firming creams and anti-cellulite creams. I'll tell you, I used one, I loved the way it felt, didn't make a difference.
Okay, it feels like you.
At
if
age
you put,
18.
Look, if you put witch hazel or astringent on your skin, it's going to tighten it up and it makes it feel good, but it doesn't last. It just can't.
So is it
doesn't-
really affecting like cellulite?
No, it's not affecting what's causing cellulite, which is a very interesting and complex interaction between fat and collagen in the skin, and we don't know yet how to treat cellulite the right way. There's a lot of great
You
things.
suck it out.
Well, actually, I
Right,
suck
so.
out fat a little bit deeper than the cellulite level. There's great things coming out, portable lasers, radio frequency, things like that. That are almost ready for prime time.
You know what I'll tell you though, in this current new beauty issue, I'm trying to find it as we're sitting here.
Okay.
I just glanced over it before. There's a really in-depth article on cellulite, its causes, and
Good.
its
Well-
counter whatever, something to get rid of it.
Right, so once you study cellulite and you study its anatomical reasons, you'll realize there's no way a cream can help.
Right, it's related to food, exercise, all kinds of stuff. But I
Genetics.
really recommend this new beauty, this current new beauty issue out
I like that.
for the
magazine.
Southwest.
well
It's the
written.
summer-fall issue.
Some of my professors are its editors, and
Right.
so you know that it's actually well written.
But in all the cellulite articles I've ever read, I've never seen a more definitive article like I have in this current issue.
All righty then.
So that's it. A couple
All right,
good
well, you've
words
been
in there.
listening to Western Medicine on Top 1260 KTRC. We've got a great show ahead of this. We have a great guest coming up soon.
Get
We've
your
got
skin tip next.
Right,
Don't
the
forget the
skin
skin
tip of the
tip.
week coming up next, so we'll be right back. Thank you.
Yay.